And listen, all of us are going to get to that point where our independence is valuable to us. Of all the subjects and all the topics that I present, one of the most common that people ask me about is value of care, and how do we communicate value not just to ourselves as providers, but to our staff. And listen, that's no easy feat. So today we're going to talk about value of your care and how we can get that ingrained in our mind and get it ingrained in our staff's mind. Value is a different term than cost or price, and you need to get that right first, because what we do is we tend to jumble up all those words and almost make them synonymous or synonyms of each other. Not true at all. Price, cost, value, these are all different words with very different meanings. And we can talk about price, we can talk about cost to people, but listen, value is not just cost or price. It is a perception of the benefit relative to what's being asked in terms of time and money. So what is the benefit to care? If we have to look at this perceived value or value as a perception, and it's the benefit compared to something else, what is the benefit to care? Have you ever really looked at the care that you provide and compared how that looks to other options the patient might have or utilize to fix or help their problem? Let's take something as simple as low back pain. You're not a low back pain specialist. You're much more than that. But this is something that you and I take for granted. And even though we take it for granted, the cost and the implications of what's done to people outside of the world of chiropractic is it'll shock you. It really will shock you. You know, people with just uncomplicated low back pain, if they're going to get surgery or pain meds or pain management or go to PT, there is going to be a cost associated with those services or with those products. And it's not just the direct cost associated with those, it's the impact that has on their life. Some people, they have to take the medication, and that prevents them from driving a car or operating heavy machinery. What if their job is operating heavy machinery? What if they have to go to the therapy office multiple days a week? Is it going to be as convenient as coming to see you? Typically, a physical therapy session is going to be somewhere between 22 minutes to almost an hour. Now, is there benefit to that? Sure, there's benefit to that. But that is typically pretty expensive. And if you don't have insurance, then now you're dealing with a different kettle of fish. So look at what you do for just a very uncomplicated case. You keep them working. They get to stay engaged with life as they're getting care from you. That's very, very special. No restrictions with operating heavy equipment or whatever. What if it's a complicated case? What if it is a surgery? Have you had those patients coming to you saying, "Hey doc, I've got a surgery scheduled in a few weeks. I'm hoping that you can help me before I get there"? Well, that surgery has a cost associated. It has a risk associated. It has a recovery associated. And though each of those things in and of itself is expensive and consuming with time and money and resources, and it disengages your people from life. What about a Medicare type patient, a patient who cherishes their independence? Do you know what it costs someone to have round the clock care, or an adult sitter come in and help out, or go to an assisted living facility? The cost would blow your mind. And listen, all of us are going to get to that point where our independence is valuable to us. See, value of care is impossible for you to judge just strictly on your fee schedule or what you're charging for an adjustment. Value can only be determined relative to benefit, risk, reward, outcome, and the other comparative treatments your patients could be engaged with. If you need this one over and over again, please access it over again. Listen to our resources on the AMC training library when it comes to comparative cost and taint nothing doctor. I mean, this is a subject that is near and dear to my heart because it's been near and dear to the heart of the people that have trained me, and I'm glad to be able to offer it to you today. So use this one and make sure that you get yourself elevated and authentically elevate the concept of value to your patients, to your team around you. We'll look for you next time. Until then, God bless.